Hi, I'm Dr. Eric Balcabbage and welcome to the genetics area of the website. If you've come to this page, you might be looking for some helps in regard to genetic polymorphisms, something we call Snips, and you want to know if genetics play a role in your health problem or your health condition. Maybe you've gone to someplace like 23andMe and gotten your raw data, and now you need to know where to go to get a genetic report. Maybe you've already gotten a genetic report. It's got so much information you don't know what to do with this thing. These genetic reports are things that I've spent the last couple of years really studying and really getting into the science of these genetic polymorphisms. We know that some of these are really important for health and physiology. We know that some of these are not that important. There's not much research behind some of these. There's lots of reporting systems that are available now. There's lots of websites that are more than willing to generate a genetic report for you and then make prescriptions of supplements based on those reports. That is not what I do. Genetic reports are not the tool for your health. They are a tool. As far as I'm concerned, the best way to use genetic reports is to use those in combination with a good health history, a timeline, a list of all your symptomatic complaints, a list of getting as much treatment or testing data as we can get, things that you've done in the past, treatments that you've done, medications you've taken, how those things reacted, and getting as much data as we can about your health history and testing, and then using that data along with a genetic report to understand why your health broke down the way it did, why you have the symptoms or conditions you do. And then we can use those genetic reports as tools to help us understand maybe the best way to go about helping somebody heal and recover in the shortest possible way. So it is a tool, but not the tool. Gene SNPs, for most people, these polymorphisms that are on these genetic reports are not the primary cause of most people's health conditions, their symptoms. Yes, if you are born with a health condition right off the bat, the genetics may be the primary factor. But for most people who experience problems later in life, it is something called epigenetics. It's your diet, your lifestyle, your environment, the foods you eat, the chemicals you take, the medications you take, the air quality, the water quality. Those are things that have a greater impact on your genetic expression than just these gene SNPs on their own. So you shouldn't be looking for the gene SNPs as the answer to all of your healthcare problems. There's no holy grail there when you look at these things. If used appropriately, they help somebody who has a background and understands many of what these gene SNPs do and how important they are. That it can help guide care, but it doesn't determine the care necessarily. You should not be looking to treat your SNPs. I know there are plenty of websites that will generate a report for you and give you a list of 5, 10, or 20 supplements to take on a daily basis for each and every genetic SNP or polymorphism. I don't believe that is the way to help somebody. Matter of fact, it may not just be not beneficial, but it actually may be harmful to someone to do that. I think some of these websites are doing this not necessarily for the patient's benefit, but for their own financial benefit. Most of them are tied to selling supplements. And so the way they make their income is to some degree generating the genetic report, but more importantly, they are making their income from having a patient now need a lifetime of supplements to take to support their genetics. Treating your genetic SNPs is like treating your symptoms with medications. It may work, it may not work, but it's not going to fix the underlying issue. The underlying issues for most people lies in epigenetics, their diet, their lifestyle, and the things that influence their genes, not the genes themselves. Typically, when you have a genetic report, there's going to be a number of different responses that are going to happen when you go to a provider's office with your report. You're going to get some providers that say, I'm just not interested. Okay, I don't believe that that's a problem. I don't think it has an impact on your health, and they're just not interested. They don't want to talk to you about it. They don't want to look at the report. That's just, some people are just going to be like that. So you should expect that. There are going to be some doctors that you go see, some healthcare professionals, that you're going to show them a report like the Strategene report, which is the one I highly recommend. And they're going to be interested in it, and they may think it's neat information, but they don't have the knowledge base to be able to decipher what it means, or to do something about it, or to help you have that information help you improve your health. So more than likely, they're going to tell you to go find somebody, or maybe they'll recommend somebody like me who can help interpret that genetic report so that we can use that as a tool to help you get healthy. The third type of person is the group that I talked about before. These are doctors or groups primarily on the internet where you upload your 23andMe data, and once you upload your 23andMe data, it'll generate a report and it'll generate a supplement list that you should take on a daily basis to support your supplement or to support your genetic SNPs. Now, while this may be a great business model for them, I don't think it's beneficial to the patient. There's no way we can know how much B6 you should take based on your genetic SNPs, or how much glutathione you might need based on your genetic SNPs. It just doesn't work like that. But these people are really more out for money than they are out for your health and your benefit. The last is doctors like me who use the genetic report as a tool to understand why you might experience certain symptoms or develop certain conditions when your health goes south. When you start having lots of stressors or lots of epigenetic factors that are making you sick and unhealthy, these are the things that can start to create symptomatology or make these genetic SNPs become more dominant or more activated. And so we use this as a tool to help somebody understand why they probably have these symptoms and conditions, but those genetic SNPs don't necessarily tell us that that is something that needs to be treated. It just helps us get the big picture of what's going on and shows us potentially the best way to treat somebody. But we use these genetic reports in combination with your health history, with your health timeline, with what medications you're taking, with what supplements you're taking. We'll want to take a look at the testing you've had done previously, and not only the testing you've had done, but the treatments you had done along with those tests and what those results were. And maybe what supplements you've taken in the past and reacted negatively to, or what medications you've taken in the past and how you reacted to them. All of that information along with your genetic report helps us get an idea of what's the most efficient way to help you heal and help you recover. But it's not based on just saying you have this gene SNP at COMT, so you need SAMe and magnesium for the rest of your life. You may or may not need it. It may be you have a genetic predisposition to have a slowed gene and a slower enzyme function, but there's other things that influence why that COMT gene may not work well. And it may not be that you just need more magnesium and SAMe. It may be that you have an estrogen dominance or you're taking an SSRI. There's a number of reasons why that gene may not work, and it may not have that much to do with the gene polymorphism. So what should your expectations be? If you want to come and work with me, I'm going to tell you, you should expect to fill out a comprehensive health history. You should expect to fill out a timeline of your health history from as far back as you can remember to current day, with information like what sicknesses and illnesses and conditions have you had in the past, what treatments have you done. And so all of that information is really important. I want to know what medications you're taking. I want to know what supplements you're taking. I want to know how you've reacted to those things. I'm going to want a thorough health history. I'm going to want to see the tests. As many of those tests as you have, and I want information on what was done for those test results and what was the outcome of the treatment and what maybe those follow-up tests were. And I'm going to take all that information along with your genetic report, and then I'll give you an assessment of what I think is going on. What are the mechanisms at play that are compromising your health, that are causing your symptoms, that are causing your health conditions? I'll let you know if this is a case that I can help you with or assist you with, and what types of further testing you might need, what types of supplementation may be beneficial. And for many patients that come and see me with a genetic report, one of the first things I wind up doing for many of these patients is taking them off a boatload of their supplements. It's not unusual that somebody comes to me who's seen somebody else and they're taking 5 or 10 or 15 or 20 supplements on a daily basis. They are going bankrupt taking supplements because somebody told them, or they did it on their own, they started taking supplements for every SNP. That is not how you get somebody healthy, and that is typically the way you make them worse. So if you're interested in consulting with me, expect to do those things. My goal is to help you understand mechanisms, to understand why you're sick and how we go about helping you get better. It is not, and I will not, my interest is not in looking at your genetic report and telling you you should take this SNP because you have this gene defect, or you should take this supplement because you have this SNP defect. I will not do that, okay? So if that's what you're looking for, is a recipe based on your genetic profile, that's not what I do. And you'd be far better off going to some place that will do that for you and will sell you unlimited amounts of supplements, as many as you want, for every genetic SNP that you have. But that's not what I do, and I don't want that type of practice, and I don't want that type of person coming to me for help, because that is not the type of help you're going to get. But if you're looking for someone to help you understand the mechanisms for why you're sick, for why you have the symptoms you have, for why you have the conditions you have, for why past treatments may not have worked, to help you understand the most efficient way to get better, then you should call my office, schedule a consultation, fill out all the information in detail, and then I can sit down with you on the phone, on Skype, or in the office and explain to you my assessment of everything and give you a potential, I can give you recommendations as to what should be done and a potential treatment plan and protocol going forward for how we're going to help you heal and recover. So if you're interested, call the office, schedule an appointment today, okay? Take care.